computer, and recording is now. All right, and then live on Facebook. Okay, it should be going.
And are you on Sunil Pai or are you on Sanjevani?
House of Sanjevani.
House
And
of
then we post that. So if you can get on there and then post it to your stream, please.
Yep.
All right,
go there
everybody,
now.
we're here on Facebook Live. We'll be starting shortly our show, Take Back Your Health. Today we have some really cool and important information, up-to-date information, life-changing information on diet, lifestyle, natural therapies, particularly what to eat and what not to eat. So just hang in there. The show will start very soon. Oh, I got to go live now, right?
Mm-hmm.
I don't think I put the time.
All right, we got about 30 seconds.
Okay.
Says you're live on Facebook.
All right. Let's see how it's going. Come on, Zoom. My internet's really slow. All right, everybody, here we go. 3, 2, 1. We are now on Facebook Live. Let's see. Are we there? Where am I? Do you see it?
I see it. You're live, brother.
All right. We're live on Facebook here. We're going to start our show in very shortly here. Please stay tuned for a great episode.
Hemp oil for everyday health. Visit us on the web at Fivita.com.
Welcome to Take Back Your Health. Your hosts are Dr. Sunil Pai and Maureen Sutton, who will explain the shocking truths about healthcare, prescription drugs, food and supplement industries. They will help guide you to take back your power and feel great again. Now, here's Dr. Sunil Pai and Maureen Sutton.
Welcome, everybody. I'm back. We're back. Take Back Your Health on Voice America. We have been renewed for another season. Thanks to all the worldwide listeners, all those in the United States, every city around the country, and around the globe. Thank you very much for tuning in to this broadcast. Today's a great show because we have some exciting and important news information that is latest breaking news, as they would say on the television, on health aspects. Today we're going to talk about an update. I was recently at a conference and it's called PPOD. You can go to plant-based prevention of disease, but you can go to preventionofdisease.org, preventionofdisease.org, and you can actually go next year. It's for doctors, healthcare providers, and also the public. And it's very inexpensive. It's a nonprofit organization, just evidence-based information, no pharmaceutical input, no supplement input, just hardcore data from the scientists and doctors and researchers, life-changing event, life-changing information. Today, I'm going to share some of that highlights, and then over the series of next couple of weeks, I'm going to invite as many of those scientists and doctors to the show so they can get into each of these topics just specifically in their area of specialty. But today, we want to cover the summary so everybody can get jazzed, and we want to see we have a special guest, Theo. Hello, Theo.
Hello.
Let me see are you there? There we go. All right, Theo's here today, and we're gonna really have a crash course on information. And so, first and foremost, I want to talk about something very simple, and we're just gonna go very, very quickly because this is a show I want everybody to go back and forth and listen over and over and over again. So, one of the things we're talking about is what is the best type of diet, and that would be the best type of diet we're looking at is a whole foods plant-based diet. And we're going to talk about what is considered good, what's considered better, and what's considered the best. And for all our patients here at Sanjevani and all you listening out there worldwide, you should be striving for the best diet, not an average diet or a better diet, but the best. And since 60% of our patients in our practice now are cancer patients, we want to really just set the record straight, right? We want to put people in the best place for having an improved outcome of their health, not just with the cancer, but heart disease, diabetes, arthritis, colitis, Crohn's disease, dementias, you name it, all the top 15 diseases, we now will have the evidence to show. And then we want to basically put it out in the camp to everybody else who says differently Where's the data? Where's the evidence? Okay. So one of the things just I want to talk about real quick is I'm going to show out some statistics because this is so amazing. Okay. They were presenting two large studies. One's called the Adventist Health Study and the other one's called EPIC, and it was EPIC. Okay, we're talking about 96,000 patients since 2002 that have been tracked, and another 65,000 patients since 1993. These are large, large studies, not just 2 or 3 people, not a case report, not even just some book that's been written off by a journalist or some ad hoc cardiologist, for example. But these are the results on eating a whole foods plant-based diet. They had the lowest BMI, meaning body mass index, and we know that the better the normal body mass index, the lower your overall diseases of all diseases. Number 2, cardiovascular disease is down by 42%. 42%. So if I had a drug, that reduced your cardiovascular risk and events by 5%, it would be considered a blockbuster. It'd be probably $8 to $13 billion blockbuster worldwide. Everybody would be taking this drug, okay, just by diet alone. Hypertension, that means blood pressure, 75% lower. 75%. Diabetes type 2, 62% lower. Cancer rates, almost 20% lower in those people who eat a whole food plant-based diet. Cataracts, the clouding of the lens, that everybody gets cataract surgery, 40% lower. Diverticular disease, this is like your GI tract with the outpouchings, and then people get colitis and inflammation from that aspect, 72% lower. Kidney disease, 52% lower. And kidney stones, 31% lower. So again, these are impressive data. Now, I want to talk about one simple study talking about plant-based diets, because we want to first start off with the main ingredient that we want to talk about that is lacking in all animal protein diets, keto, paleo, you name it, even the Mediterranean diet, is a lack of fiber. And fiber is important because fiber helps with a lot of things. Fiber is a prebiotic that feeds the probiotics. It helps support your immune system. It helps slow down blood glucose. It helps lower the cholesterol levels, helps improve transit time, and also helps your microbiome in terms of your immune system. 80% is in the gut. Now, one of the things is that fiber produces N-butyrate, which is the energy production in the gut to help colon health. Now, in Africa, one of the speakers at this conference actually was being Skyped in. He's in South Africa. Wonderful data. He showed that the Africans in Africa who eat a traditional African diet, that means no refined carbohydrates, real complex carbohydrates, and people need to understand what a difference between a simple refined carbohydrate like white breads, white flours, white sugars, and actually real like vegetables and grains and legumes and fruits, for example. Those are what we call complex carbohydrates. But those people in Africa, the Africans in Africa eating a traditional diet, have the lowest colon cancer rates worldwide. Okay, less than 1 per 100,000. It's almost non-existent. Probably can get hit by lightning easier than actually getting colon cancer, okay? Now, why is it they eat the highest fiber diet in the world, which is really impressive, okay? Now, what they did is they took this study where they took these Africans, they actually did a colonoscopy and biopsy of their colonic tissues, and then they actually fed them. They went to a food center, and they fed them all the meals, the standard American diet. Cheeseburgers and ribs and lobster, all the wonderful things that we think, and also me and most people when we come from a poorer country and we come here and we always are looking at Western movies and we're looking at things, we're looking at, gosh, American food. I want to have a Big Mac. I want to have all you can eat ribs. I want to have finger licking good fried chicken, for example. So they fed these people 2 weeks standard American diet. They repeat the colonoscopy, and on the biopsy, it already shows within 2 weeks precancerous lesions starting to develop. Precancerous lesions starting to develop within 2 weeks of eating the standard American diet. Now, colon cancer rate is pretty high, right? I think it's like number 3 cause of death in America. I might be a little bit off there, but men are higher than women, and of course, there's different people in the country. The more slower your transit time, the more history of colon polyps and constipation, higher risk of colon cancer. But why this is increasing overall worldwide? Because of our standard American diet, and now importantly, this ketogenic fat, which is actually even lower, actually a lot of times in fiber, is now being just exponentially being marketed. So now, within 2 weeks, then taking these people that already have precancerous lesions and going back to their standard plant-based diet, it reverses those diseases. So again, 2 weeks is all you need. Theo, what do you think about that?
I'm not surprised because this has been my life for the last couple of years. As you know, we've been proponents of food as medicine as a cornerstone in managing and treating a variety of diseases. And I had the pleasure of working with several of these researchers you're talking about, including Dr. Hans Deal in the epidemiological study that is the ASH2 and the Adventist 1 and the Adventist 2 study. He's actually the lead PhD epidemiologist. So all this is like not new to me, but I have to tell you today, I'm actually at a level of frustration because it just, what keeps showing up is this really bad fad. That's not like where you'd say, well, there's a good, better, and best diet, and the standard American diet's the worst. Instead, we actually have to say there's a worse diet than a standard American diet. It's been proven in a large series of studies, and it's called a ketogenic diet.
Right.
So it's like,
so explain to the listeners, because you and I get this. We read data, we follow things, and I see patients, and you help coaching with patients as well.
Yeah.
But let's talk about this. When they look at overall, on thousands, hundreds of thousands of patients, and they look at morbidity and mortality, that means like how your quality of life is, and then how soon do you die, right? In terms of longevity. And they have like the standard American diet, which is now considered like the worst diet, right? And then they have a ketogenic diet, and then they had a plant-based diet. And explain the data outcomes, because that's where sometimes people don't understand. Everybody's saying, oh, I got to starve my cancer. I got to, I can't have highly refined carbohydrates or any kind of carbohydrates sometimes in that matter. Explain why that's so dangerous.
Yeah, gosh. So there's so many elements of that I feel like you just opened up Pandora's box. So we're going to let a bunch of stuff out. And I think in order for people to understand why the conversation is so frequent is because if you type in the word keto diet or ketogenic diet like that, tell me when the first scientific study shows up. Is it about, I don't know, page maybe 4, 5, 6, or maybe the 12th pages of results? It's all businesses. People are making millions of dollars by spewing or retelling, or maybe they believe something to be true. Whatever it is, they're positioning themselves and they're doing these things. But and the truth is, though, that diet has actually been well studied, because to be a ketogenic diet, to truly embrace that, you would have to test your blood. The device is $40. It's $5 every time you test it. And you would need to test it every day until you got to a point where you understood if your diet had in fact helped you to become ketonic, or a state of ketosis. So in a state of ketosis, we're taking our fat that either through diet or what's already in us, and we're converting it for energy. And so really this is about vanity. This entire conversation is, we're an obese nation, we're gluttonous, we can't seem to stop eating, we just love to eat crappy forced delicious foods that we think are foods, they're not. But at the end of the day, this idea of ketogenics and converting this as a fuel has been now touted as being the next breakthrough in cancer. But this is 2018. We've been studying this for a very long time. The term keto became popular maybe 8-10 years ago, but this was actually studied when it was just a high-fat diet, because that's what most people are doing, right, Dr. Pye? Most people are not doing the whole, like, I'm checking.
No, most people don't. They buy products that say, hey, you don't have to do all this. Just drink this shake, or just eat these things, or take this, and it'll be that way. But I just want to give the listeners real quick before we go to break a simple a concept. I'll give you an example. So last year around this time, I had a young gentleman. He was below the age of 30, so it's coming in around 28, 29. He was overweight. He was an IT person, working with computers, engineering computers, kind of technical issues. He was overweight. It was almost about 300 pounds. And so he picked up at the store some kind of, keto blueprint primal book, and he went hardcore. He was like, I'm falling. So when he came to my office, he looked really shredded. He looked like Brad Pitt. He had got, ripped abs. He looked really healthy. And I couldn't really understand why I was here. Looking at his chart, and then I was looking at the chart, I was looking at the diagnosis, looking at him. I was like, hey, something's wrong here. He's like, he showed me pictures like, oh, I used to be this much weight, and I lost all this weight, et cetera, et cetera. So I said, why? So why are you here? He's like, well, because I have stage 4 colon cancer with metastasis. 28 years old, within 1 year of doing that diet. And we already know within 2 weeks, we see the pre-cancerous changes in the colon. So again, just want to stress right now, when we come back after the short break, we're going to talk about, improvements of how to lower the inflammation, how to improve your phytonutrients, your antioxidants. We're going to talk about microbiome and a lot of interesting data. We even talk about a little bit about sexual health, because, those people who think about primal, they're actually going to have lower sex drive and actually higher erectile dysfunction. So again, we want to give a shout out. One of the things that I like to remember to remind all my patients, and what I take every day, is Glucan 300. Go to Pure Beta Glucan, get some of yours. to understand what I mean by this. It's the strongest beta-glucan available for your immune health. And we'll be right back after these messages from our sponsors.
You're clear.
All right, everybody. Hey, everybody on Facebook. It's Theo and I again talking about diet. We got a little carried away there. We're going to go back upon this, because we can talk about this forever. My book is An Inflammation Nation, which I'll mention again on the thing. It has a lot of the research, but there's so much new research. And every time I turn on Facebook right now, all I see is someone hawking and selling these pseudo doctors, these pseudo naturopaths, chiropractors, and pseudo MDs, who say that they're integrative, but they're not, because if they were, they would be completely evidence-based, and they would be interviewed on my show, or they would be actually writing a book that's very similar to what we have in our book, or the evidence that's been published. Everybody else is pushing things that people still want to hear. I want to have my cake and eat it too, but I'm complaining about my diabetes. Or I want to have my cheeseburger and complain, and eat it too, but I'm still complaining about my heart disease and taking all these pills. And now we have the cancer phase where now so many people are having cancer. So definitely you want to really listen to what we're saying today, because this is going to change your life. If those people who you follow are telling you otherwise, then they are not having your health and your best interest. They're looking at a consumer or a customer or a fad. They will make money and they will be off somewhere in the Bahamas while you end up probably having more trips to the pharmacy and to the hospital. So I just want to bring that to awareness, because a lot of people might have good intentions, but we're talking about when the information is there. And now one of the things, it's fact. It's no longer a debatable issue. It's like you either understand facts or not. Now you can either say the climate change exists or not. So you have to sit on one side of the fence and say, when facts are there, you can't deny it. And if you don't believe it, well, then you got what's coming, right?
100% agree with you, Dr. Pi.
Okay. So everybody, I do want you to go to sanjevani.net, 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 and sign up for our newsletter, because you're going to get some important information, not only on our shows and our guests, but you'll also be giving some specials and different events that we have. We want to keep people up to date with some really important activities. And sometimes we have events coming to your area, and sometimes we also have events that we want to help promote, like PPOD, the prevention of plant-based prevention of disease. Go to preventionofdisease.org and go to the conference next year and actually be able to ask questions to 20 to 30 of the most experienced leading researchers and physicians in the field, reversing disease in their patients, not just treating them, but most people do. And in fact, most people on the internet don't even see patients, right? So we have to be careful of people who say, oh yeah, I'm practicing, and they don't even have an office.
Yep. Yeah. And just real fast too, somebody brought up, because we're playing with a broad brush.
Coming back, guys.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Welcome back, everybody. We're talking about life-changing breakthrough information on whole foods plant-based diet, which is now considered the fact. There's no more. At the conference, interesting, there was a kind of a sub-discussion going on that within 5 years, it's my opinion, by the way, as well, but some of the other doctors, that, physicians who do not recommend someone eating a whole food plant-based diet will be complicit in their patient's disease and eventually be a form of malpractice, just like telling someone that it's okay to smoke when we now know that it's not 30 years later after 7,000 studies. So even now we have all the studies there, so the doctors are complicit because they themselves do not want to change. If you're seeing a provider that is not healthy, then maybe you should switch your providers. Or if they're trying to do the change, then I would say, hey, that's a good person, because lifestyle change is not easy, but it's also not easy having diabetes, hypertension, obesity, depression, cancer, you name it, right? So these are small little changes. Now, one of the things that I want to talk about is blue zones. Recently we're looking at longevity, and in the blue zones, these are the places around the world. There's one in Greece, there's one in Costa Rica, there's Italy, Okinawa, Japan. These are the people that live longer than 100, the centurions. There's common factors to what they call the blue zones. They all have a good sense of family. They all don't smoke. They have moderate physical exercise and activity, so they keep fit and active. They're not sitting on the lazy boy watching the game all day or just lazing around. They all eat a plant-based diet, and they have a high amount of legumes. And that's one of the key things that they showed, that if for every 20 grams of legumes, there was a reduction in mortality about 8%. Okay, and then also with fiber, I think it's with every 5 grams of fiber, you decrease your cancer mortality 18% as well. So these are simple things: eating some beans and lentils and legumes, and eating just more plant-based foods because plant has fiber. So one of the things I just want to talk about is what's protective about plant-based diets. By the way, whole foods, that is plant-based diets: fiber, phytonutrients, plant enzymes, antioxidants. They're anti-inflammatory. They have plant sterols and stanols, pre and probiotics, and macro and micronutrients. Now, animal protein diets, unfortunately, is what we call a pathogenic diet. It actually creates disease. Okay, so it's not protective, it's pathogenic, meaning it creates disease. Trans fat has excess saturated fat, which we're trying to avoid. It has something that stimulates, it's called NEU 5GC. This is a new compound that the research now has been shown that when we get animal protein and we cook it, this sugar molecule that's in the animal protein, it's not a refined sugar, it's in the animal protein, it has now been linked to actually have some carcinogenic effects and actually be one of the biggest challenging factors there. TMAO, which is a metabolite in the gut, which has now been linked to cancer. All animal proteins are pro-oxidants. They're not antioxidant, they're pro-oxidant. And they have hormones, chemicals, heterocyclic amines, and also endotoxins that cause disruption to the microbiome. So I just want to start off on that because those are certain simple things that people are talking about. Hey, you should be eating this type of diet. It's like, well, you cannot take a bone broth and heal your gut. That's a simple understanding of medicine, GI health, immunology, microbiome. If someone tells you to eat bone broth to restore your leaky gut, they need to go back to school or I would fire them, period. Because they are complicit in your disease. There's no phytonutrients, there's no antioxidants, there's no fiber in bone broth, right? Any comments there, Theo? I know I'm kind of getting a little strict here, but I hear this every day. I got patients coming in. They're like, I got bone broth. I got a keto and cancer book. I'm doing all this stuff. I'm like, and this is why your cancer is getting worse. And we haven't talked about, chemo, radiation, or surgeries or natural therapies. You cannot change your health unless your terrain is better. And until someone is actually truly healthy, then they have better response. If you get chemotherapy, if you do natural therapy, you'll always have a better response if your foundation of health is better. Right. So let's talk a little bit about some aspects. One of the things that we're talking about is lifestyle changes. So this is all what we call, our clinic's called Sangevany Integrative Medicine Health and Lifestyle Center for a reason. For 18 years, we understand that's a lifestyle change. So you want to start doing some slow changes daily. 70% colon cancer risks and stroke are prevented by lifestyle change. 80% of heart disease, 90% of type 2 diabetes, all through lifestyle changes. Now, there's 4 lifestyle changes that they were looking at. Being active, like with exercise and moving around, eating a healthy diet, non-smoking, and having a good BMI, like a regular body fat. Less than 3% of the population has those 4 characteristics. Right? So this is why we're in the state of disaster, an inflammation nation. This is why our healthcare is $4.3 trillion and people are still not healthy. Right? So now let's talk a little bit about microbiome. What do you want to talk about, Theo? There's a lot of things to talk about.
Gosh, well, first of all, you can't have health without it because 80% of your immune system is modulated from your gut. And then everything that we do is violent to it in modern medicine. We use overuse of antibiotics and everything else. So I think in the microbiome, we look at, well, what's good for it, what hurts it, and what's neutral. As it turns out, almost nothing's neutral. And some things we can choose to do, obviously, support it. So prebiotics help to support what we consider to be good biota or bacteria that defend on our behalf. And a lot of pathogens don't care about fiber. In fact, they'd prefer you didn't have any fiber in your diet. But what you eat can so quickly change your microbiome. I mean, you look at the ability, I think it's, Ornish and I can't remember her name. They published on that and they were able to so significantly change the microbiome after just a few weeks or months of a diet change, right?
Yeah, but now we even have another study that came out more recently. Human gut microbiome rapidly responds to dietary changes. 4 days only needed to start to change. So if you eat a standard American diet, ketogenic paleo diet, it increases Biophyla Wadworthia, which is again part of the microbiome that actually triggers inflammation in the gut within 4 days. Again, remember, just in 2 weeks it started precancerous lesions. So again, anybody saying you must eat these foods, again, are really complicit in your disease. I mean, they should be sitting with you in your doctor's office as well, getting the treatment, because they're just setting you along the same path. So we got to look at, 5 grams of fiber every day. Now, remember, what has fiber in it? Not animal protein. So if I go and I get nice wild Alaskan, wild caught salmon, does it have any fiber in it, Theo?
No.
Okay.
No.
What about pasture raised organic eggs?
Rhymes with 0.
No. Okay. What about grass-fed finished beef?
No.
No. Okay.
No.
What about raw milk?
Nope.
Wow. Okay. So, so just want to
Wait, what about cheese? Is there any fiber in cheese?
No.
No.
No. So again, because everybody's like, oh, I need to eat this much amount of food. And, I have a lot of patients, even in my practice, who come in saying, hey, I'm trying to eat better. I'm trying to eat more Mediterranean, right? So they're eating more wild-caught salmon. The problem is that still doesn't have the fiber. And remember, a lot of people who are talking about paleo diets now are saying, hey, well, we're healthy because we're eating this leaner, cleaner food, right? Like, grass-fed, finished, wild-caught, and they're eating some seeds and nuts. But they're not getting to the 35 to 40 grams of fiber that you need a day. Why? Because if you're eating all this other animal protein, there's no way you can eat all the other types of fruits and vegetables that you need, 10 servings a day, roughly, of vegetables and fruits, because you'd be full. You'd be eating a bucket of chicken, you're done. You're like, I can't even eat the sides after a bucket of chicken. And those sides don't even have fiber anyways. But anyways, just, kind of put that in perspective now. Now, heart disease, one thing at this conference, we had, heart disease every 20 seconds. Someone's having a heart attack in America, right? And number 2 cause of death in America, right? Heart disease. Number 1 is still Western medicine side effects and errors, right, from Western care and side effects of drugs. 2 is heart disease. 3 is cancer. 4 is stroke.
Hold on, wait. Did you just say that the number 1 killer in America might be your doctor?
Might be your doctor and the medications that are prescribing, or the errors also that are occurring due to factory medicine now. We call it factory medicine because people are coming in and they're just, it's just so many. I mean, and unfortunately, most doctors are just overwhelmed. They're just seeing so many people because the insurance companies are pushing them. So when we look at heart disease, we had a great doctor there, and his name is Baxter Montgomery. Hopefully, I'm going to have him on the show. He's a cardiologist in Houston, and he has like severe heart disease patients coming in. They were showing patients coming in with even 10% ejection fraction. Your heart needs to have like 65% or more to be really super healthy in how it pumps. And then what happens is when they get lower than 40, they have heart failure. They're on these drugs, diuretics, blood pressure medicines, all these, heart pumping drugs. When it gets to 10%, they actually have a pump that goes inside the person's heart to give it the medicine directly to keep it pumping. He can put people on a whole foods plant-based diet, and he has actually a plant-based diet in his clinic. So patients go, he stabilizes them medically with all the wonderful medicines that we have conventionally, and then he puts them on this diet, and then guess what? Within 4 to 6 months, that ejection fraction of that patient went already from 10% up to 40%, which is now almost borderline of getting to a little bit of a normal function. So,
and you still have vascular too, right? You're looking at dilation, and there's a factor of when it opens up on hydraulics that there's a multiplier.
Right. Yeah, every time you open the vessel radius, it's to the power of 4. So every time it goes up, exponentially 4 times, there's more blood flow. Also, the opposite occurs. So when it shrinks, when people have heart disease, remember, high animal protein, high cholesterol, high inflammation. So for every 1% of cholesterol above the normal, there's increased 1% risk of erectile dysfunction.
What?
Yeah. So we can see that's why when we see all these people like, hey, I got a cholesterol problem, and then I'm not only taking my statin, I'm taking my Viagra type of drug. It's because that's the canary in the coal mine, as we always like to say, right? So another reason to eat more plants is that you need to have more of the natural antioxidants to produce the nitric oxide naturally and to help reduce the vascular flow. Only thing that's been shown to actually reverse, that means reverse the actual plaque in the coronary arteries, is a whole foods plant-based diet. And within 6 months, we can see changes on angiogram. And we've had wonderful cases where we've been able to reverse all vessel disease in patients just through diet alone. Dean Ornish, many other people have been shown that. Esselstyn, everybody else has been been able to show that. So now, coming after this short break, we want to start talking about other things like proteins. We want to talk a little bit about inflammation, and just continue on with this discussion. Again, we want to thank our sponsor for helping us move forward, which is Glucan 300. If you go to purebetaglucan.com, again, support those people who look at evidence-based practices, how to keep your immune system strong. Again, on our website, we will have all the research there. You can look at it comparing to all different products out there. Again, purebetaglucan.com, go to that and get some, I take it every morning. It works for me, and it works for our patients very well. All right, so after we come back, we're going to carry on this discussion with Theo Hansen, and we're going to get a little bit more into protein, a little bit into carbohydrates, and we'll finally end up on what kind of daily diet you should be eating and how much. We'll be back after this short break.
Clear.
Yeah, and Dr. Pai, you mentioned Doctors Gobelik and Esselstyn and their work in atherosclerosis and the ability, they actually on camera reversed heart disease. And if you've ever been around Caldwell Esselstyn or his son Rip, those guys are like diehard about like really bringing fat down. And then Ornish brought fat down to 10% of the calories in a prostate cancer study. And everyone who was compliant to diet had all their early stage prostate cancer reversed. They could go, all their numbers drop and go the other direction. And everyone who didn't went the other way. They all had to have
right. And I want you to bring that up on the air. I want you to bring it up on the air because prostate cancer is a big issue. And a lot of people think like, oh, I still need to have my animal protein because I'm a male. I need this and that. And you're like, you need your prostate.
Yeah.
And you need
all the male elephants. Yeah. The male gorillas.
Right.
I got to go eat a guy. I got to eat some animal.
Right.
Yeah.
So, all right. And then everybody out there, go to Sanjevani.net, sign up for our newsletter. We have some important information, and there'll be some really cool things coming out later on this year. Hopefully, I was part of a little bit of a pilot project, which I can't really say too much about, but hopefully it'll be picked up, and then there might be a really cool television program that I might be a medical advisor to participate. And we got some other cool products and things coming out that are all evidence-based because we're moving now on comparative studies, looking at what is better, not just, take this or take that. We always have to look at, is there studies to show which is more safe, which is more potent, which is more pure, which is more efficacious. At the end of the day, you need to make the food the medicine. Right. And also the supplements that you do take, they also need to be shown that they work. It's not just, again, someone just touting on Facebook or social media or Google ads that it works.
Yep. For sure.
Now, one of the things everybody, again, mentioning, there is a conference that you can go to. I'm going to recommend next year go to something called Peapod. I'm really pushing this because it's really inexpensive to go to. It's probably the most cost-effective conference I've ever been to. And they actually have plant-based food there, so the food was good to eat. It was in North Carolina, and you can see these wonderful
coming back
and researchers and actually participate in the discussions.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
We're back here. We're talking about life-changing breakthrough information, whole foods, plant-based diet. I can't say enough about it. There was 3 days of conference with just world-class physicians, researchers, scientists, dietitians that I recently attended, and so I wanted to share again. Every 5 grams of fiber, you decrease your cancer mortality 18%. 100% whole grains have been shown to reverse and improve cardiovascular disease. Everybody's worried about whole grains or grains in general. Read my book, An Inflammation Nation. You'll get all the data there. What you want to do is eat whole grains, not refined grains. Whole grains are important because you maintain a lot of the beneficial aspects that you're losing. So, for example, when you have a refined grain, you lose 80 to 90% of fiber. You lose 70 to 80% of the vitamins and minerals, and you also lose 95% of the most important phyto plant, as you can see around me, nutrients. So you really want to get whole grains. You actually want to see, whole grain breads or sprouted grain breads. But the more refined, if it goes from a whole to a whole cut, or then a rolled, and then a shredded, and a ground, and a flaked, and then finally a puffed, the more that is refined, then you're just losing that. So even if you say, well, I'm eating, whole puffed rice or kamut flakes or something, again, no, you want to go back to the real whole grains itself in your foods. So let's talk about proteins. Everybody's talking about protein today. Everybody thinks that you need to have more protein. And one of the things that we look at is, the amount of protein. Can you get enough protein in your diet? What do you think there? Adequate protein, according to science, which we like to use. Science, which is kind of scary for many people, unfortunately, these days. Adequate protein is about 0.5 to 0.8 grams per kilogram per day. And most vegans, most plant-based people, believe it or not, get 1.5 to 2.0 grams per kilogram today. So there's really no need for actually any additional protein for energy intake to get your essential amino acids and stuff like that. And in fact, the average person needs about, males can have, 50, 60 grams of male, and then about 35 to 40 grams of fiber. Now, if you're calculating your fiber, this is a simple thing to know. If you're calculating your fiber and you have, say you calculate, the average American's having 7 to 12 grams of fiber a day. So if you calculate your fiber, what you want to do is you don't want to just go to 40 tomorrow. You won't like it. Your stomach won't like it. You'll have horrible gas and cramps. What you want to do is you want to go up about 5 grams per week. Right? So just remember, these are lifestyle changes. But realistically, in your lifestyle, you don't want to be the 1 in 2 men that have cancer coming in your lifetime and 1 in 3 women that have cancer in their lifetime. All right? So protein. And, is there any difference between animal protein and plant proteins?
Endless. As we go through that, because you just touched on something, just as a stat, and I'll be glad to share this with a link for listeners, is that for breast cancer, which is something I care a lot about, as a lot of people know, I'm a cancer patient advocate and a researcher. But there's for every 20 grams of fiber, and this isn't like powdered fiber, like you're not taking Metamucil or some other brand. We're talking about eating the whole thing, getting the real source, because there's elements that are on there that belong there. There's a 50% reduction in breast cancer, and again, I'll send the link on that because I think it's super important. But yes, there's a difference in protein. And what's probably more important is what comes along with that protein. So when you eat a plant-based protein, first of all, you don't need to supplement. You're getting sufficient. We're a protein dominant society that just thinks that somehow protein makes you better. Yet throughout history, every standing army, they always did not eat an animal-based protein diet because they knew that would actually slow them down and make them less athletic, and their performance would be compromised. But it's what you eat that comes with that protein, is looking at the way that those saturated, monounsaturated, and trans fatty acids are. It's a fatty acid situation that we come back to when we look at animal-based proteins. They're actually poisonous by definition. Animal-based proteins are poison. You can say it a different way,
I know.
but they're poison.
The funny thing is, like, when you think about protein, even gladiators. When we think of the fighting in the Romans, all the gladiators were eating grains. Yeah. There's only the people in the stands who were unhealthy, who weren't fighting, who are eating the animal protein. But it's, the perception has been flipped that we think that everybody. But remember, animal proteins are pro-inflammatory. Go back and listen to the shows, the anti-inflammatory diet, the first one, and go back and understand, what you can do to reduce your inflammation naturally, like taking things like Bosmeric SR. Go to bosmeric.com to learn more about that, or read my book, An Inflammation, and you can get that at aninflammationnation.com as well. But more importantly, plant foods are anti-inflammatory. Now, one thing about animal protein is that animal protein stimulates insulin growth factor, particularly dairy proteins. Right. And we now know that cancer cells have 10 to 12 times more insulin receptors. Wonderful studies showing that the more dairy you eat, if a cancer cell is already present in the body, which it is usually a lot of times, throughout the year, we have certain cancers that are developing and our immune system is taking it out and repairing and fixing. But with this excess, it actually stimulates the growth because, there's 10 to 12 times more insulin receptors. So we know that dairy does not do the body good. It does not improve bone density. It actually does the opposite of what we've been told. And so we have to be careful, because a lot of people are trying to say, hey, I need to eat more cottage cheese. What about the Budwig diet? Or I need to eat more, I need to have more dairy for my bones. And, many doctors will say, hey, you need more calcium for your bones. This is a very, very bad type of food. One thing that they brought up at the conference is when we're consuming other types of proteins, wolf protein has 12 times more protein than human milk. Okay, cow protein has 3 times more protein than human milk. Why is that? It's because they grow faster. Human milk actually has the smallest protein amount than all the other mammals. It's only 1.2%. Right? So why is that? Because we grow very slow. We're not within a few weeks we're 2,500 pounds. Well, hopefully not. Maybe some parts of America we might be getting there, but we have to be careful. So a lot of people are like, why are we consuming? And now they showed studies with early child height and growth. Drinking a glass of milk a day put them at a higher risk of actually getting breast cancer and other cancers as they're adults, just because of this growing effect. Okay, yes. That affects all sorts of endocrine, hypothalamic, pituitary, immunological aspects. So we definitely want to avoid having animal proteins, particularly dairy, particularly if you're a cancer patient. right?
Oh,
But
yeah,
everybody should
yeah.
be, you know?
But it's because IGF, by the way, it's insulin growth factor. I mean, we're talking about like something that if you have cancer, you should stay far away from. But homocysteine and higher choline, carnitine, all these are like in your colon, they get like when you're trying to digest them, they get converted to TMO. And so as a TMO, the microbiome promotes cardiac disease, ischemia, heart, stroke, prostate cancer. Oh my gosh! Like.
Yeah, talk about the prostate cancer, because, that's great data, because men, this is near and dear to men, with breast cancer for women, both of them share colon cancer, but prostate cancer for men, it's very important because everybody thinks, again, I'm a man, I need to eat more protein. It's kind of like this, very masculine thing to do. But prostate cancer and the treatments for prostate cancer is very demasculinizing because of the side effects, radiation, surgery, hormone blockers, erectile dysfunction, and urinary incontinence issues. So if that's not scary enough to make you eat better, I don't know what else would make someone eat better, knowing that that's not the way to go, because most of those patients, their quality of life does change, and we can prove it. So talk a little bit about the prostate cancer studies and what happened when people ate plant-based.
Yeah. So, and again, I'll share a link with audience so you guys can get the perspective of two sides of the spectrum from early stage and also late stage prostate, because a lot of times we think that things haven't been studied. But Dr. Dean Ornish moved forward and did in 2005, I think it was, started a prostate cancer study, updated 12 and 15. And what they find is that if you take and reduce protein intake to down to 10% of your calories, that prostate cancer will reverse. It literally, if you eat a whole foods plant-based diet devoid of animal protein and you reduce the protein amount, and this was across anybody in the study group, and then outside in the control, those folks who were able to just eat whatever they wanted to eat all had to have surgical intervention, but not the ones who were compliant on his side of it. And the update still holds true. And that's on early stage. We also see it in late stage as well. So I think that his work was groundbreaking. And yet when you talk to an oncologist, they tell you what you eat doesn't matter.
Right, but we do know, and then even what we do in our practice is then we go further. We say we put you on a whole food plant-based diet. Number one, we want to check to see what foods trigger inflammatory responses like food sensitivities. IgE, IgG4 is immediate and delayed. Something happens within an hour. Something happens 4 days later. We look at your microbiome. We want to see your good probiotics, bad probiotics, small intestinal bowel overgrowth, candida, parasites, inflammation, leaky gut. We can restore all those functions, right, through diet and natural supplementation if need be. And then nutritional evaluation. We want to look at what is your antioxidants, your phytonutrients. Now, one thing we always hear is that plant-based people need B12, right? We're deficient in B12. So one thing I've been looking at is we took a 6-year review of all our charts, because we're doing nutrition testing on everybody for the last 15 years. And we look at, it tests like B vitamins, folate, and all the Bs and antioxidants and minerals and stuff. And believe it or not, since the ketogenic paleo diet is really popular now, every single patient that I've seen now that we've tested, it's not just, someone is vegan and they're not getting the B12, right, in the diet. Because remember, B12 comes from microorganisms, which then are consumed by the animal, which we're not eating because we don't consume as much of the dirt or the microorganisms as we used to. However, those patients who come in who are complete paleo and keto, they're just as nutrient deficient. Why? Because the animal that they're eating is not eating its vegetarian diet, right? Mm-hmm. So it's no longer you are what you eat, is you are what you eat is eating. And 97% of American animal protein is factory farmed.
So I think it's higher, but sure, I'll take 97. Yeah.
So that's just, everybody thinks like, I'm getting some kind of grass-fed finish and some organic. They're not doing that at every meal, every time they go out to a restaurant, every time they're getting something at the big box factory store or whatever. So again, nutritional deficiencies all over, but you need to have everything that's behind me here. For those people who are listening, you have this wonderful basket of blueberries and raspberries and mangoes and bell peppers and squashes and kale and chard and asparagus and potatoes and tomatoes. I mean, these are the peas. These are all the legumes and grains, and even avocados as a healthy fat. These are the things that people should be eating very liberally, as much organic as possible. For those people who don't understand the difference between organic and non-organic, go back and listen to our show about organic and GMOs and glyphosate. That was a great episode that we talked with Dr. Zach Bush. You'll learn a lot about the microbiome and understanding why our guts are all disrupted now by eating such things.
Yep. In fact, United States Department of Agriculture, I'll put it in the notes right now for folks on Facebook, but they say that 2 out of every 5 Americans is flirting on being deficient in B12. and yet that's wait, hold on, that doesn't make sense. I thought only vegetarians and vegans were low because the math isn't adding up,
Math doesn't
guys.
add up, right?
Like,
Right.
and it actually, and we don't need as much B12 when you're not eating a lot of an animal diet. You don't require to have as much in order to do the job it needs to do. So we all have to look at supplementation because we've ruined our soil. That's our fact. Is we're just not getting it. We don't have, like Zach Bush's, we're not protecting the microbiome of the soil.
Right. So when we come back after this short break, what we want to talk about is certain take-homes. What can you do easily? How much should you eat it? These are things that you can take and make your food the medicine. At the end of the day, food is medicine, and supplements supplement the diet. They never replace the diet, right? So when we look at recommendations, we like the things that are targeted therapies that are added to this wonderful diet. Then you can have improved outcomes. All right, everybody. So hang on. After this short break, we're going to come back with now new lifestyle changes that you can take home and put in today's dinner and lunch and breakfast tomorrow.
Mm-hmm.
All right, you're clear.
All right, everybody, we're on Facebook Live. Thank you for joining us. I'm here today just talking about plant-based. If you can see behind me, this is what we should be eating every day. I can stress, to my patients, I went plant-based in 2009. It's changed my life, changed my partner's life, changed my practice. We've had great outcomes. Unfortunately, I'm in a business where in integrative holistic medicine and kind of alternative medicine, people are just pushing ketogenic diets, fad diets, bone broth powders, all these things which are just not evidence-based. They're not healthy, but there's a big marketing push. Again, people don't want to hear something that their grandmother told them. They want to hear something that some jazzy video or some fitness guru or somebody who looks, good on camera is asking you. But they're not holding your hand during your chemotherapy or radiation. They're not holding your hand during your surgery or biopsies, and they're not holding your hand when you're doing your insulin or getting your bypass or your stent. And so this is what we have to really be careful of: is whoever's providing your medical advice or just general health advice, what is their motive? And follow the money. Follow the money. Where's this money going to? What is the source? Everybody's going to say, well, now we have organic this, organic that, a bone broth. Why are we still selling you bone broth? Right? So something that's already bad, if I put gold foil on it, doesn't make it better.
No, it makes it perfect.
So you really want to make sure that people are just not spinning you out, because really it's their bread and butter, and we want people to really be healthy at the end of the day. All the listeners out there, I really care about each and every one, and it's a revolution that's going to happen. Revolution never comes without a warning. Michael Franti says that one of his songs, and it's gonna, you can feel this vibration where people are now sick, they're tired of being sick.
All right, come back.
And this is one way you take it back: make your food the medicine.
Listening to Voice America Health and Wellness.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Wow, what a show this has been. Great information. I hope you're all enjoying this as much as me, and I hope you can look at eventually. The listeners go back and look at the background on my green screen. It's beautiful. I think that's what you should be on your plate every day. Reversal of heart disease. We can happen, reduction and reversal of, now there's even not only improving your microbiome, but lowering your colon cancer rates significantly. Just within 2 weeks, you can start changing that. Now we have studies showing colon polyps reversal with plant-based diets. One thing we want to talk about real quick is diabetes. Diabetes now prevalent, 70% of the population having some kind of insulin-resistant obesity, diabetes risk. And we now know that 84% of the American population that has diabetes is on medication. 16% are uncontrolled. They're not on any kind of medication. And now there's 12 types of medications out there for diabetes. Yet we know that when you go on a whole food plant-based diet, you can pretty much reverse this if you have a physician that's guiding you. That's what we do in our clinic, and the other people do that around the world, like Furman and McDougall's and Esselsons and Caldwell's and all these wonderful people out there. But one of the things is just remember is that while we're stuck is because, like, for example, the American Diabetic Association, if you watch the movie What the Health, it's a very good movie. You can get that, watch it on there, What the Health, Forks Over Knives. These are one of our favorite ones to look at. But, there's 10 pharmaceutical companies that have paid the American Diabetic Association. It's on their website, under the corporate support on their website, is that they've given $5 million each So why is that? Because they still want to control and manage your disease. They don't want you to reverse it. And we want you to reverse it. We want to be free of as much medications and be on the least amount of supplementation that you want and be spending as much money on your diet, lifestyle, environment, and belief system. We want to change your epigenetics. We've been doing a program that we'll have available if you want to go to thevitaprotocol.com and look at that. It's free download, and you can then learn about if you have cancer or any kind of chronic disease and you want to join a program. We'll take you through 12 weeks of epigenetic changes, diet, lifestyle, environment, belief system, all the testing that we talked about, and coaching, how to get you there. So whatever you're doing, you'll be in a better state of health. Please do that. Go to thevitaprotocol.com. So, Theo, what else do we want to tell our listeners today? I mean, there's a lot of information we covered. Diabetes, heart disease. We talked about colon cancer. We talked about breast cancer. We talked about, inflammation. We talked about microbiome. Right. And I think there's three things I always tell everybody. If anybody says you should be eating a ketogenic diet, paleo diet, or whatever, or even just a Mediterranean diet, then there's three things that they don't know. They don't understand inflammation, they don't understand the immune system, and they don't understand the microbiome. End of discussion. Right. So it's that simple. It's no longer having an argument that this protein is better, that's lacking amino acids, that's not complete, No. It's like you either understand fact or fiction, and that's it. And you either understand microbiome, inflammation, and the immune system. And if you don't, then the argument's like, I don't even have the discussion anymore, because I'm like, those providers are not educated, and they're actually ignorant and complicit in your disease. Simple as that.
And it's either because they're super busy and there's no space in the current business model for them to continue their education, or they're being irresponsible and they're not going through. Because there's been so many studies. You look at Predimed, for those who ate greater than or equal to 57 grams a day of animal compared to those who ate like 25 grams, there was a 28% increase in heart failure mortality. I mean, like that's Predimed. This is a massive study that nobody's arguing was like somehow poorly constructed. And 57 grams a day, I only wish Americans ate that. They eat way more.
I know they eat about 120, 140 grams of animal protein. That's why we have kidney disease, and that's why like we have certain places like here in Albuquerque, we have like DaVita corporations, which are large dialysis corporations that run basically almost everything in our city, because they're looking at how do we end up plugging people in and then billing the government. We have to look at is always looking at how to take back your health. That's what the show is about. It's about empowerment. You don't have to be rich. You don't have to have a lot of money. You don't have to live in a good neighborhood. You can speak a different language. You can live in low income housing. All these foods that I have here back behind me, if you can see this, vegetables, grains, legumes are pennies on the dollar. Beans and legumes you can get dried. You can go to local farmers market. You don't have to go to the fancy Whole Foods. Just go to local co-op, go to local farm. And now there's all these online delivery systems that deliver these foods to you. So if you live somewhere rural, a box will come and you can get those things. I want to just talk real quickly, so when we say that the recommendations now are 10 or more servings of vegetables and fruit a day. So you need to be having at least 3 servings of legumes. Legumes are like beans and lentils. So you can have, and a serving is like a half a cup of legumes, right? Beans or lentils, some tofu if you want, organic, obviously, a cup of fresh peas or sprouted lentils or peas, 2 tablespoons of a nut butter. So that's like 3 servings of legumes, okay? 3 servings of whole grains. A serving is about a half a cup of cooked grains. So you can have quinoa, millet, sorghum, brown rice. I have brown rice. I have red rice. I have jade rice. I have forbidden rice. I have black rice. There's so many different rices. People are like, oh, I thought there was only white rice. It's like, you got to explore this. Remember, so there's a lot of cool things. You need 1 to 2 servings a day of seeds and nuts. So 2 ounces of nuts if you're eating like a trail mix or snack, or 1 ounce of a nut butter. Okay. You want to avoid refined carbohydrates and sugary sweets, right? So avoid sugar, sodas at all costs. Sugars, cookies, candies, donuts, white flours, all you can eat breadsticks, pull aparts, all those kind of things, just generic white rice at a restaurant. Avoid this, but you can have all the whole grains. Complex carbohydrates are okay. And so if you just start off with those things, making the whole food plant-based diet your foundation, and then looking at something like, how do I increase my immune system? Well, take a Glucan 300, make sure your vitamin D levels are in the optimum range between 50 and 100. If not, take a little bit more with your largest meal, making sure that you're taking a probiotic. Making sure your microbiome is good. If it's off, get that tested. Look for foods that may be triggering, because you can still have a sensitivity to a plant. If you still have any kind of inflammation, take a natural, clinically tested anti-inflammatory like Bosmeric SR. For more information about all these things that I'm talking about, and also all the data, go to inflammationnation.com and get a get a signed copy of the book, I'll be glad to sign it and send it to you. Thea, what else do you want to talk about before we end the show today?
Yeah, I'm gonna just throw it into for those who are following us on Facebook as well. Just as a going out thought, good, better, and best gold standard. The AHS2 study, the Adventus2 study, looking at 89,224 people. It's a lot of people. If I try and eat a lot less animal, just that little move is 28% reduction in diabetes, 23% reduction in hypertension. I only eat fish, no beef. It's a 51 and 38% reduction. I only eat eggs, 61, 55% reduction. But wait for it, here it comes. Plant-based healthy vegans, 78% reduction in diabetes and 75% reduction in hypertension. Or you can try to take that statin pill that only works for 2% of the population, or take the diabetes medication, or you can waste your life. It's up to you, but that's the good, better, and best. And where was keto in that? Nowhere to be found, because it doesn't belong there, because keto rhymes with crap. So if you're talking about a keto diet, eat your crap
keto is
diet.
actually worse than the standard American diet. So anybody who's not been saying it's actually worse. So again, remember, it was a 28% increase in morbidity and mortality all over, and then
Cancer.
And then you got this reduction if you eat plant-based. So again, you don't want to get worse than the standard American diet, but that's what people are doing. It's a fad. Don't follow it. Don't be fooled. Remember Atkins 20 years ago. I mean, this is all reinvention paleo. Then they're trying to make themselves sound a little bit more intelligent, trying to sound like ketones. One thing we need to know for all the cancer patients there who are trying to starve their cancer from their highly refined sugars, which is true, right? You want to eat complex carbohydrates. But one thing is that ketones have been shown to fuel cancer growth and tumor growth and metastasis. That's been published data. So don't think that you're just going to starve your cancer. Cancer will change its metabolism and sneak up 2.5 times more growth and 10 times more metastasis to lung on the ketogenic diet. So everybody, it's been a great show. I hope you've enjoyed this. It's been a quick run through. I'm going to have the next couple of weeks a lot of interesting physicians and scientists that we saw at this conference. I'm going to try to get them on the show so we can talk about other things. We'll talk about other aspects outside of the diet. We're going to have wonderful, wonderful information. I want to thank you all again for supporting us. Go to sanjevani.net, SANJEVANI.net. Sign up for the newsletter. And if you have any questions, send us an email at radio, RADIO, at Sanjevani, SANJEVANI.net. And I'll be glad to review it and read it, the answer on the air or the question on the air on future episodes. And Theo, do you have anything else to say to the wonderful listeners out there?
What you eat matters.
Yeah. What you eat matters. Food matters. Remember, food is medicine. And I'm Dr. Sunil Pai here at Take Back Your Health. We will see you next week, every Monday here at 2 p.m. Mountain Standard, 1 p.m. Pacific, 4 p.m. Eastern. Please share this video. Please have as many people join the movement here, the food revolution. Again, thanks again, and best of health.
All right, you're clear.
All right, everybody here. We're still here live on Facebook. So I just want to see a couple of things here. Anybody commenting here?
Yeah, I'll throw a quick one in, because one of the questions that came up was, as a female, how much protein should you eat? And it's a really good question. And I think I can give you super scientific answers where you can get a scale and you can weigh things out, or you can totally relax, eat a bunch of plants, greens, beans, onions, mushrooms, berries, seeds, right? It's diverse, colorful. You eat that, you're going to get all the protein in the world that you need. You will not be protein deficient. It's impossible. You will not be. I mean, Kim and I haven't touched an animal. We haven't had animal meat since 2014, and we declared that we would never even look at an animal product in early 2015. I don't think anybody thinks that we're protein deficient. So if you just want the easy answer, it's just eat the color of the rainbow, plant-based, and you'll have all the protein that you need, male or female.
Yeah, there's no really, protein deficiency in America. There's nutrient deficiencies in America, right?
That's right.
There's antioxidant deficiencies. There's fiber deficiencies. There's phytonutrients. Remember, phyto meaning plants, only comes from plants. So one thing I forgot to say on the air, but remember, there's no pill that prevents or reverses or treats a disease that comes from, beef. There's no beef pill, there's no chicken pill, there's no egg pill, there's no pork pill, there's no lamb pill, and the fish is the fatty acid of the oil. It's not even the fish protein. And now we can get that from seeds and nuts and other aspects, flax, chia, and hemp seeds, giving you still more nutrient of protein and fiber along with the omega-3s. So again, 50 grams, 60 grams, right? You can throw around that as if some people want to calculate. But the idea is that when you go plant-based, you don't have to calculate, but you want to make sure that you have a rainbow color of food, that you have, legumes, you have grains, you have your fruits, and you have your veggies, lots of veggies, and you just eat as much as you can. Remember, those foods have very low calories, so most people will lose weight. If you have a little bit trouble with maintaining or keeping weight, or you're a little bit underweight, just make sure that you add a little bit more, not too much, but add a little bit more whole plant fats, like a little bit more of avocados, a little bit more nut butters. I don't really like too much of the oils. I want to be a little bit more on the lower oil, but not having no oil. I'm not too much unless you're a really high risk cardiovascular patient and had some procedures or stents or something like that. We want to be a little bit extra strict, but we want to look at, you still need to get that healthy fat. That's not putting a stick of butter in your coffee. Okay. That's not, what everybody else is selling you, something that's bulletproof. No, that's a bullet. It's a bullet to your heart and a bullet to your head. Okay. Yeah. And all those people are just pro-inflamed. And you can actually see some of the guys who invented these things. They're really inflamed. Their skin is inflamed. They feel inflamed. They're complaining all the time about it being achy and inflamed. But I'm like, well, then what are you doing? So it's follow the money, see who's selling you what. At the end of the day, is there any culpability of what they're telling you? And if there's not, if they say, well, I can't even reach these people, they're just, celebrities or movie stars or, docu-series people or internet personalities, then you got to be really careful, because we are now talking about people's lives. And now too many people are just getting information haphazardly, who are desperate, who are in fear, who are in pain, who are suffering, and no fault of their own. They're just trying to find better information. It's hard to discern because, the savvy marketers, the algorithms, even the trolls can convince people otherwise. And we want people really to be healthy and happy at the end of the day, have community, have a good environment. One of the episodes I'm going to talk about in the future is the environmental impacts of factory farming and the environmental impacts of eating plant-based. And so it's not just for you. It's not for your heart disease and diabetes and your cancer and your Alzheimer's and dementia. It's about, how do we slow down climate change? Or now, I guess according to this administration, has to be called weather difficulties now, right? So how do we lower that is by eating a plant-based diet. Try to eat more local foods. Try to eat more in season. Try to eat more fresh foods. And then we'll even talk about later on, there's some aspects of oxidation and oxidized LDL and how even heating animal protein, freezing it and reheating it, this is also changing some of those aspects that make those foods even worse. And so people might say, well, I'm eating some kind of organic grass-fed and it's frozen and I reheat it and I'm going to put it back in the freezer again. That's actually going to cause even more damage down the line. So again, try to eat as much fresh. I'm not against people sauteing and steaming their vegetables again, depending on your digestion. So it doesn't have to be, everything has to be raw. I like things slightly sauteed and steamed. You can get a rice cooker or ceramic rice cooker, throw everything in there, all your grains, throw your vegetables, it steams it, it sucks it back down, all the nutrients. It's right into the food, so it's easy to digest. So those people who have really, really sensitive guts, then that, don't just go, oh, I'm going to eat raw and I get gassy and I have stomach cramps. No, you got to improve your digestive function first before you just start eating more vegetables. Remember, 5 grams a week to get to the total of 35 to 40 grams over time.
And again, that's gonna cut your risk. Anything over, every time you get to 20 grams of fiber, you're reducing your risk for like women, for example, breast cancer by 50%. So you add 20 more, you've cut that again in half. So you've cut your overall risk by 75% by hitting 40 grams of fiber. I mean, like it's incredible to think how simple it is to save our lives. And unfortunately, I know it's not popular. If you and I would be willing to change our tune, I suppose I could go out and pick out a new Porsche or Ferrari if I was willing to sell my brothers and sisters on the planet. And it makes us unpopular. I don't like going to parties and everyone like, oh, so, I'm keto. What do you have to say about that? I'm like, good for you. Like, I don't even what do you say to them? It's like, yeah, but how do you explain a lost weight? Calorie deficit? Right. Like, I don't know. Like, I feel like we're in a different world and it makes us not the popular kids at the dance party.
Yeah. At the conference that I was at, on the PPOD conference, there was a, I was sitting there and I was looking at the news feed during the lunch break. I shouldn't do that, but I do. And there was a headline on the news, I forget, like Huffington Post, some of these, whatever, news channels, whatever. And it's like, cardiologist is now touting the carnivorous diet, eating 4 pounds of red meat a day with no fiber. 4 pounds of red meat a day. I mean, so we'll just keep on going to this extreme. And oh, they like to fight with vegans. They like to fight with this. And I'm like, you don't have to fight. I mean, you're just going to get cancer and heart disease and diabetes. I mean, let's see this cardiologist in 6 months. Because in that 1 year, that kid who was half his age, unfortunately, had stage 4 cancer
Yeah.
passes, right? So again, it's not saying we're better. It's like no one is going to be better with that type of, you put bad fuel in your car will not run appropriately. It's just that simple. We're not trying to say anybody's better or anybody's worse, but what we want for everybody is to be free of disease. The
Yes.
average person, 8 to 12 pharmaceutical drugs that I see, 15 to 20 supplements a day as well, right? Multiple providers, primary care and neurologists and cardiologists and GI doctors and psychiatrists and then you see a chiropractor, a naturopath, and then my massage therapist and my acupuncturist, and the list goes on and they're still not healthy. So
Yep.
you have to go back to the basics, which nobody wants to talk about because they can't sell a basics IV of nutrition for you, right? You have to get it through your microbiome. A Myers cocktail will not fix your disease. High dose vitamin C will not fix your disease. These are things that sound good and everybody wants the magic bullet or the natural magic bullet, but really we should be actually maybe using a NutriBullet or actually even eating those things, cooking those things, but we shouldn't be thinking that we can just bypass the system. You can't biohack the body. You can't biohack nature. You have to follow the laws of nature. I keep on saying this. If you understand nature and you follow the laws of nature, nature will reward you in kind. If you try to biohack it, then nature has a tendency to slap you down very quickly.
Mm-hmm.
Right?
Yeah. Yep. 100% agree.
And that's why everything that's a fight, all coming from nature. And so obviously try to get more organic, more non-GMO, obviously try to use less chemicals in your environment. In my book, in Inflammation Nation, I have 10 steps for you to follow. Just go and have all the references, over 1,300 references or more of all the studies. And, it's also talking about community and, yoga and meditation and exercise and other things that you can do. So it's not just, only eating healthy, but you have to, it's the foundation of where you need to start. And then little changes, like Theo said, just a little bit here, a little bit there. Keep reducing. So if you went from the standard American diet to saying, okay, I'm now only eating, some chicken, and now I'm going to only eat some fish, and now I'm only going to eat some, eggs and dairy, and now I'm eliminating. You can do the slow weaning if you want, if you're not in a crisis mode or you don't have severe disease, but there's no time better than now to change.
I think now is the time. I think one of the questions that came up, and it was Ula that posted it, and I know Ula is a long-term listener and a friend to Sanjevani, and she asked about keto coffee, and I think that's a really important, that the way she brings it up is really real. First of all, I want to say there is no such thing as a ketogenic coffee. So what it is a keto coffee is a brand, it's a product, and this is brilliant. We thought that they did a great job with paleo. Keto's kicking paleo's ass as world's best marketers, telling a lie that more people are buying. RJ Reynolds right now, the cigarette company, is like, man, how do we do that? How do we do like the keto thing? And then they're hiring agencies to figure out how to keep the confusion on and maybe bring back in cigarette smoking.
Hey, maybe there's a keto cigarette.
It's got to be around the corner. It's got MCTs in it. I'm serious. I actually know somebody who's
MCT cigarette delivery.
I know somebody who's working.
Vapor. Oh my God, I can.
It's already there. They're already doing it, Dr. Pi. They're already doing it's a CBD delivery in which it's a keto CBD delivery system. And I'm just like, oh, you got to be kidding me. So keto coffee is just fat. It's just high fat. So if we just say like high fat, why is high fat good? And somebody else asked the question earlier about, well, what about for autism and epilepsy and others? Okay, let's stop using the word keto and let's talk about fat. By increasing the fat from like say 15 to 25% of your calories, we can change uptake. So fat helps us, depending on where you're at in the health spectrum, we can utilize that as a tool, as a carrier. So it has a benefit. But keto is 65% of your calories coming from fat. That's exactly the study that shows that's how you die unless you're actually totally understanding ketosis. And if you are understanding ketosis, then you are understanding that you have to cycle. The best way to become, if you want to really win at keto, is just go on a water fast for a day or two every once in a while. It's like Chris Wark said, keto, it's just like fasting without any of the benefits. Like you could literally just water fast for a day and you'd be ketogenic and you're not going to have to worry about heart disease or any of these other bad things happening. So if you want to do stuff with your coffee or anything else that you want to do in life and you want to add some fat to it, you have to really look at your overall picture. So there is no such thing as keto coffee. Bulletproof coffee is David Asprey literally stumbling on the most incredible thing, which is that addicts will do anything in order to be more addicted, right? And so, and then wherever this, the cattlemen's industry, they're just over high-fiving keto. Best thing ever came up, ketogenic diet. Let's go pay, Dr. Seyfried a PhD. Let's have him run around and sit on stage at cancer events talking about a ketogenic diet being novel for cancer treatment. How about let's not? Like, let's not have that guy on the stage. He's never walked anybody to death's door and back. He's never walked anybody anywhere. He sits inside of a laboratory environment. So why are we letting people like this make decisions for what we do?
And when you feed a rat chow, high carbohydrate chow than regular chow, but we don't eat chow.
No.
So there's a little bit of this aspect of when they look at the ketogenic studies in rats and animals, and they look at the benefit of, well, gosh, if they went ketogenic, they survived a little bit longer. We're not talking about reversal of disease. So a little bit longer is just like taking a pharmaceutical drug. You might live 3 months longer. You still die of the cancer. That's still not helpful at the end of the day. Right. And we have to say, did we improve the quality of life? Did we lower inflammation, improve the microbiome? Did we, all these other things we talked about in the show, lower your lipids, lower your sugar, improve your phytonutrients, antioxidants? No. So we have to be careful of how people tout that, because we had studies showing that the ketogenics will actually fuel cancer cells, because cancer, remember, I always tell my patients this, cancer is like cockroaches. It's been around for millennia. It will adapt. Okay. And that's why cancer has not been cured per se. Okay. Now there's people that survive cancer. We help people through that all the time with conventional therapies, with natural therapies. But the goal of those people who survive is by changing that terrain. If they don't change the terrain where they get conventional or alternative therapy, they're more likely, 50 to 80% are likely to get a recurrence within 5 years.
Yep.
Okay. And so the sadness is that it's not that the therapies failed. What's failed is that the system, the medical system, the holistic providers, the media, the Facebook has not told the person yet what to change that got them in the situation to begin with. And if you change that, it's like if you change the direction on the car, or you put a seatbelt and now you put, airbags and you put air in the tires, then you're less likely to get in an accident. And if you do, you're more likely to actually survive it and walk away from the crash. And that's what you're doing with your diet. And people who are selling you otherwise are basically selling you a car with no tires, no airbags, no seatbelts.
Yep. So here's what chow is, because if anybody's ever wondered, either find somebody that you can trust and is actually working with patients and creating outcomes you can measure, or go back to school and learn how to read stuff. But chow for rodents in laboratories is made by Purina. Okay, remember Purina, cat chow? It's called chow because that's what Purina makes it. And this is what's in it. It's 23% protein, crude protein, and only 4.5% fat. So where's all the rest of the calories coming from? Wait for it. It's not from greens, beans, onions, mushrooms, berries, and seeds. It's from sugar. Mm-hmm. It's a sugar meal. It's ground yellow corn, soybean meal, wheat middlings. It's sugar beet pulp, fish meal, ground oats, bruised dried yeast, alfalfa meal, wheat germ, spray dried whey, animal fat preserved with mixed tocopherols, meat meal, calcium carbonate, salt, choline, chloride, calcium phosphate, lysine, methionine, something with vitamin A acetate, vitamin A palmitate. I mean, the list goes down.
They have to add all those vitamin and minerals because there's none of that in just the sugar there, right?
There's none.
They're trying to give some kind of, they're trying to put the multivitamin minerals in there. But the idea is that the chow diet, saying, chow versus a ketogenic chow diet, that's not the good kind of comparison that we're talking about here. Right. And that you can't apply that to a human diet. But again, I think what my goal with this show, and hopefully Theo, that you've been helping me and other people at these conferences, is that it's no longer a debate. You either have to say, I'm either pro-disease or anti-disease. I'm either pro-safety or I'm anti-safety. I'm either pro-data or I'm against data. And if anybody else who sells you otherwise is not in your best interest. And it's a hard thing to swallow because but they look so nice and they sold it to me and they smiled and, I'm now on auto ship and all this stuff. And they come into my office and they have, spread of cancer or worsening of their diabetes. Now they're on 3 more medications and insulin, or they had a bypass. Now they have more. I had a lady the other day, 17 stents, 17. I don't get easy patients, by the way. Okay, so a lot of people are like, Dr. Pod, do you see healthy people? Like, I wish Theo came to my office as a patient because that would be really nice. I don't see healthy patients. 3, 4, 5 vessel bypasses. Brain tumors, lung cancers, colon cancers, metastasis, diabetes. But these are complications because people have hit the wall and they're like, what else can I do? It's like, well, first you got to change your terrain.
Yeah.
Simple as that. Okay. And again, we're not saying that we're coming from a place of being better. We all had to do the lifestyle change, read the book and Inflammation Nation. You'll learn my story. It wasn't easy, But am I a lot better now and happier? Is my blood test looking better than I was when I was 18 years old? Absolutely. And if you talk to this 20 years ago, I wouldn't believe any of this, by the way, okay? This is all through learning and going and studying, and not just saying, oh, there's a magic cure in Mexico, there's a magic cure in Germany, or, now there's a new, I'm just going to wait for the clinical trial for the new breakthrough medication. Now they have this, we can have access to clinical trials aspect. That's not going to help the patients. That helps the pharmaceuticals just give drugs that are now been shown that we don't have to show efficacy in order to get approval. I wouldn't want to be in a trial that doesn't show any kind of efficacy. But people think, I want to take something. What you can take is your food as medicine every day. Every day. Right?
Yeah, for sure. And I threw a link in there, Dr. Pai, because I had a little insight in 2015 on Kaiser Permanente, which is a West Coast managed care organization that's health insurance and practitioners. They service 8 million patients, and they have 25,000 practitioners. So I popped in a link. They figured it out. In 2012, 13, 14, 15, they started studying the role of a plant-based diet as an intervention in cardiology with Dr. Columbus Batiste. Then they started looking at it in endocrinology. And what they found out was that people could get free from their medication, and that the cost to support and service those people was so significantly lower. So here's Kaiser Permanente. And every once in a while, I hear like a doctor inside of their organization promoting a ketogenic diet or a high-fat diet or a stupid diet or whatever. But as a whole, they're at a very high level, they're beginning to understand that food is in fact medicine. And they actually, and the link's in there for anybody that wants to, they actually show you how to transition to a plant-based diet. Like let that sink in for a second, and then ask why your favorite naturopath or your favorite celebrity is just like, oh my gosh, eat bone broth, which is heavy metal poisoning powder, and then and do a ketogenic diet. It's awesome. It's like, no, it's really good for them to sell you a lot of crap, because you're going to feel like crap, and you're all excited and enthusiastic, and you'll buy more of their crap, and then eventually you're just in a craptastic position.
It's too much, and again, we're not trying to attack people, but we are trying to set the record straight, because at the end of the day, everybody has been taken, and then they come and it's like they're the bankrupt, they're not feeling very healthy, and they're having issues of like, I don't know what to do, I'm stuck, and they're confused. There's so much misinformation. So again, when we sell a whole foods plant-based diet, there's no funding or interest of me saying, hey, eat more broccoli and celery and carrots and potatoes, and I don't have a lobby group behind me, and that's first before I even talk about supplementation of something that might be targeted depending on the patient's disease. But what we're using from those supplements are all made from plants.
Mm-hmm.
Right. And now we're just trying to get them at higher potencies and impurities, because now we're trying to reverse disease faster, because they haven't been eating healthy stage for 50 or 60, 70 years. Right. But 5 days, you can change 4 days, you can change your microbiome. 2 weeks, you can start getting precancerous lesions, eating the standard American diet. Like, why wouldn't anybody not want to be healthy? And the idea is that then the choice is theirs, but they can't make that decision. They can't be sitting on both sides of the fence at the end of the day. You just can't say, I want this and I want that. It's like, you either want to be completely healthy, and it's not difficult. It's a challenge in the beginning to get your lifestyle, find the restaurants, learn how to cook better and all, but that's so much better than going to 6 months of chemo and radiation and getting IV therapies, or getting surgery and recovering and healing, and whether you get fired from your job, or you lose your house because your mortgage payment, your 50% of your co-insurance from hospitalization. I mean, these are things that people really have to take into consideration. Just this week, there's challenging to pre-existing conditions now in healthcare. So you have to be healthy, people. Because if you're not, they're going to say, oh, you sneezed before, you have an allergy, which everybody has some kind of allergies. And they'll say, that's a pre-existing condition. We're not even talking about cancer, heart disease, diabetes, obesity, depression, any of those irritable bowel as pre-existing conditions that they will drop you from.
Wow.
Right? So this is a really, really, really strong aspect of what's happening these days. And you have to be forthright and just take better precautionary measures of looking at, every time I put food in my mouth, I need to do it with intention. I need to do it with the right consciousness, and I need to do it mindfully, that I'm looking at, this is food that's going to feed me, not just get me to the next, couple of hours, but it's feeding my body, and I think that's hopefully everybody who's listening to the show will start, taking a closer look and paying attention to that. This is serious. It's not like, oh, I'm trying to eat healthy, but I take all these products. We offer certain things, but it's like, how do you make those things work better is by, again, epigenetic changes with the foundation of diet. We will have in future episodes like mindfulness. I'll bring in a doctor who'll talk about mindfulness and how the mind and body and food can react, and other aspects of let's get into detail of protein. And I'll try to get a doctor that works in intensive care units and critical care and talking about this. And I'll bring in, the cardiologist. Let's talk about heart disease. Let's talk about AFib. How come everybody has atrial fibrillation? This was something that was rare when I was in medical school. Now there's drugs on television. You got AFib, take this drug. You're like, what? How they can just change that. And better than drugs, just with diet. Very quickly. I mean, you're going to start seeing some things on the show coming up soon in the future that will really blow your mind. And it makes me happy because, as a physician, even the drugs that we have that can save people's lives, right now we're running out of tools. We can't just do emergency medicine on everybody. And we need to get them to have quality of life improvements and actually living, not just, holding on to life, but actually living. So any last words to the listeners out there on Facebook?
Yeah, for me, if I've offended you because you are a fanatic of a ketogenic diet, or it was never my goal to be divisive or to cause like to insult you in any way, shape, or form. What I'm only interested in is working directly as a cancer patient advocate and as a researcher. Precision matters, and a good, better, and best is kind of like the Olympics, and you have you in for the silver, bronze, and gold, right? So the gold standard is super well established, and if you have a serious disease, I don't even know why you would consider anything less than the gold standard in order to help manage and reverse your disease, because it's your life that hangs in the balance. But so far down away from that, below, like underperforming below a standard American diet.
Yeah, it's not gold. It's not silver. It's not bronze. It's like tin.
It's
it's not even that. It's just like
it's mercury. You shouldn't even be doing it.
You shouldn't be doing it, right?
And yet,
and it's weird because everybody just jumps to it and it's like that's the hot thing. It's like, who is telling you this? Again, marketing, and really got to break that fad. And at the end of the day, I'm hoping in the future that even those people who endorse those things may have some liability, because there's celebrities out there, just like celebrities that endorse pharmaceutical drugs. I think at the very end of the day, they should be held liable when drugs are taken off the market. And millions of people say, "Oh, I know that football player, that that movie star, and I took that drug because I like them." And they get paid millions of dollars. They probably don't even take it sometimes, or very little. And then someone has a side effect. I'm like, well, what was that all about? And who are we listening to? And so let's listen to, if it doesn't make sense or if it sounds too good to be true, you're probably right.
Yeah. And again, I'll just leave it out there, Dr. Pai. If anybody is a practitioner who is promoting that and you want to get into a meaningful conversation with me, I'm not here to insult you by any means. And if it feels like I kind of attacked you, I would definitely have a level of professional respect and decorum in a conversation. But just before you have it, get ready, because what I'm going to talk to you is about 33 essential nutrients and getting 100% of those from your diet. The diet has to be digestible. It has to be calorically appropriate, sufficient in fiber without artificial fiber supplementation. It needs to be anti-inflammatory. It needs to be anti-angiogenic, and it should be anti-tumorigenic if it's cancer that we're talking about. But at the very least, the conversation has to be like, that's the basis of the discussion. So if you're saying to me that it's ketogenic, immediately you have a mathematical problem. It is impossible for you to meet the very basic criteria that is so perfectly met.
And
beans, onions, mushrooms, berries, and seeds.
Right. And there's conferences. I just saw recently, in my email, blast, where it's like, keto, cannabis, and cancer.
Right? 3 things that will kill you.
And it's like the cannabis is the only thing that was safe, but but it's a little bit of issue where now they're targeting a need or a niche of people who are really desperate, and unfortunately, these people become celebrities in these little off conferences, pseudo CME, but they're not really, because no one's really vetted the information. There's companies now that you can just pay, and they get CME. So it was even shocking for me, because I used to go say, "Oh, someone's vetting these conferences." And some of these conferences, they're just not vetted at all, and they're more promotional, advertorial conferences. And someone's just got paid to just approve the medical education, but it's not real vetted, peer-reviewed education that wouldn't stand a chance anywhere else. Again, not that we're pro-drug for everything either. It's just that we have to use critical thinking, evidence-based matters. And the problem is, now there's this whole niche. It's like a subculture, like, oh, the keto. And again, as I said, we're not here to insult people. But I want to tell people that if you follow someone who's telling you to eat that diet, then you need to hold them responsible 100%. Don't be jumping ship. You got to say, okay, I'm going to follow this to the end. And if your ship goes down, you better grab them and take them with you, because they're going to be on a yacht and you're going to be on a raft that's has got a hole in it, and it's going to be sinking very quickly. So I really want people to understand, because it's your life, it's your health that someone else is guiding you. You know, they'll come in, they'll pop out, they'll do a little dog and pony show, and, you know, funnel market you to death with products and this and that. Sounds really good, look really good, even have great publicists, for example. But at the end of the day, when the blank hits the fan, they're like, go see oncology, or go see cardiology, or I'm not your provider. I'm just providing you some generic, information, or I'm just an author now, or whatever. Be careful of that, because, it's hard, because when I see patients, it's like I'm doing 10 things now, and trying to clean up this mess. And it's not that it's not fair for the patient to have, to have suffered. And they were all for doing something. So if they just got the information earlier, they would have had amazing, amazing, amazing outcomes.
Yep. McDonald's does not McLove you.
No. And in fact, before we finish, I just want to show there was one thing here that's really impressive here on this conference, is that how much money is spent. 1 out of every $6 that is spent in marketing in the United States, 1 out of every $6 that is spent in the United States is spent by one company, and that is Mickey D's. That's how powerful the marketing. That's how powerful. And I was just having a conversation with Maureen the other day. Is, a $1 value meal. And when you think of, like, I'm getting all this for $1, right? And people think, like, well, the $1 is really cheap. I go, but you have to think even more of that. The operator of that restaurant buys that product from McDonald's, and then they have to have markup and margin, right, to cover their overhead, the rent, the staff, right? So they're getting it probably like 30 cents or less.
Yeah.
Right. And then when they have days here, like in New Mexico, we have these days like 25-cent cheeseburger day. So if they're getting 25 cents, that means it's going to be about 5 cents the cost. 5 cents. You can't even buy bubble gum now. I was at the store. I was actually at the mall the other day. We went to an escape room. It was really cool. We'll talk about that later. But and then, it's like, we saw these like little, little things in the mall, like little toys and little things. And bubble gum is like 50 cents. And now you have to have a card. You don't take coins. So bubble gum, which is just cheap chemical stuff, right? And gum balls and sour thingies, whatever, right? That is still, going to. It's like, how much does a burger cost? What can you get for 5 cents? Nothing. So just putting that in perspective, people. Your body is, the most expensive vehicle around, and treat it with respect. And and nature and God's given us wonderful foods naturally to eat them, and have some conscience about that. So I think we're done for today. I think they're going to be tired of listening to this over and over. We'll bring in new topics. We'll bring in some other things. Hopefully I'll even have some things later on, even on psychedelics and other things. We're going to be pushing the conversation on consciousness as well.
Wow.
And breakthroughs, even reviewing some new prescription drugs, because we want to kind of clarify. Some drugs are pretty good. If you have to take this one, it has less side effects. And some of them are going to say, you know what, that's just fancy marketing. The data doesn't really show that it does really improve anything more than just more marketing. So Theo, any last minute words for our listeners out there?
Just that we love you, and we want you to take back your health. I just want people to be well, feel well, and I don't want them to go to their deathbed because of misinformation, and that's why we do what we do. Otherwise, I wouldn't do it. I'd wear a keto shirt and collect my keto dollars and sail my keto boat go to my keto island. And
all right, everybody. This is Dr. Sunil Pai. Thank you for. Please like us on Facebook. Please share this feed to anybody who needs to understand it. Go to Sanjevani, SANJEVANI.net, and sign up for our newsletter. And we also have wonderful information there. These videos are also available on our website. You can go to voiceamerica.com, go to Take Back Your Health, and you can also listen to all the archives since January. You can listen to it on demand or on iTunes, or just directly onto your iPhone or your Android phone. You also can go to our website and actually watch the videos, because we recorded these and we've posted them there, and also our YouTube channel. So until next week, again, best of health, and thank you for joining us.